What happens during a newborn's very first breath? Imagine a tiny baby taking its very first breath outside the womb. It is a moment filled with incredible change and vital activity. When a baby is born, its lungs are still filled with fluid, not air. This fluid is important for lung development before birth. During delivery, especially in vaginal births, the baby's chest gets squeezed, helping push out much of this fluid. Once the baby is born, the body kicks into gear to clear the remaining fluid. Hormones released during labor activate channels in lung cells that draw fluid into the blood and tissues, helping the lungs dry out. The first breath is usually a deep, strong inhale. The baby contracts the diaphragm, the large muscle below the lungs, to create a negative pressure in the chest. This negative pressure pulls air into the lungs, inflating the tiny air sacs called alveoli. This process can take up to 30 seconds. As the alveoli fill with air, surfactant, a special substance produced by the lungs, helps keep these sacs open. Surfactant reduces surface tension, making it easier for the lungs to stay inflated and preventing collapse. When the baby begins to breathe, oxygen enters the lungs and passes into the blood. This oxygen-rich blood then flows through the pulmonary arteries, reducing resistance in the blood vessels of the lungs. As a result, more blood can flow through the lungs for oxygen exchange. This change causes the fetal circulatory pathways, like the foramen ovale and ductus arteriosus, to start closing. These pathways are shunts that reroute blood during fetal life. Their closure helps direct blood to the lungs for oxygenation, instead of bypassing them. After the first breath, the baby closes the glottis, the part of the airway that leads to the windpipe. This helps maintain positive pressure inside the lungs, which keeps the alveoli open and promotes further clearing of lung fluid. Several factors stimulate the start of breathing, including the cooler air outside the womb, physical touch, and changes in blood gases. When the baby takes that first breath, it marks the beginning of independent breathing and life outside the mother's body. From a medical perspective, understanding this process helps pediatric and newborn care specialists monitor the baby's health immediately after birth. If the baby struggles to breathe or if fluid clearance is incomplete, doctors may need to assist with suctioning, provide oxygen, or give surfactant to support lung function. This vital first breath transforms the lungs from fluid-filled organs into air-filled structures capable of gas exchange, setting the stage for a healthy start outside the womb.